on your scalp consists of a hair shaft, which is visible above the skin, and a hair root, which resides in the hair follicle beneath the skin's surface. Projecting into the base of each hair follicle and hair root is a structure called the dermal papilla, which is composed of rapidly dividing cells. These cells pack together in the hair follicle, forming the hair shaft. Hair grows in a three-phase cycle. In an initial phase known as anagen, the hair is actively growing in the hair follicle. During a transitional phase known as catagen, the hair follicle retracts and pulls away from the dermal papilla, causing the hair to stop growing. In a final resting phase known as telogen, the hair follicle remains inactive. As the anagen phase begins again in the following cycle, the old hair shaft is often pushed out by the new hair as it grows. Individuals experience pattern baldness when their hair follicles begin to miniaturize. As hair follicles miniaturize, the new hair shafts they produce become progressively smaller and finer with each successive hair cycle. Eventually, some of the hair follicles become too miniaturized and weak to generate hair and fall into a dormant state. Follicles can remain in a dormant state for a few years until ultimately they stop producing hair. Laser hair therapy successfully stimulates hair follicles to reverse the miniaturization process, returning small, fine hairs to healthy, normal-sized hairs. It has also been shown to stimulate dormant follicles, restoring their productivity.